If your teenager is battling chronic conditions like seizures, insomnia, anxiety, depression, constipation, or autoimmune issues like PANS or PANDAS, you're not alone. Sadly, today we're dealing with an absolute epidemic of chronic health problems among our teenage and young adult population. Rates of anxiety and depression have skyrocketed, and the sheer number of teens struggling with poor gut health, autoimmune conditions, and even seizures are staggering. Traditional medicine offers little to nothing for these kids and their families except more and more medication to try and chase and cover up the symptoms. Many teens and young adults we meet are on 3, 4, 5, or 6 different medications and are more miserable than ever due to all the side effects and the reality that none of these medications actually address the root cause and help improve their health overall. These daily struggles can be overwhelming and leave you feeling helpless as a parent, and leaves many teens and young adults feeling hopeless themselves. But what if I told you that a common thread ties these conditions together? A dysfunction and imbalance in the autonomic nervous system is known as dysautonomia. In this video, we'll dive deep into the understanding of dysautonomia, its impact on your child's health, and a promising solution that addresses the root cause and helps improve your child's quality of life dramatically. Now, this video is for parents of children and teenagers who are struggling with a wide range of chronic health issues and are sick of going from specialist to specialist and coming away with no answers and no explanations as to what's really going on, and looking for someone to connect the dots and make sense of why your child has so many health struggles all at once. Recently, PX Docs launched a podcast episode where we interviewed 2 incredible teenagers, one from struggling with debilitating seizures, anxiety, depression, and digestive problems to an almost absolutely incredibly and fully healthy life. The story of Francesca and Cole, who have now become best friends after meeting during their intensive care programs with us, perfectly illustrated that dysautonomia is the one thing that can lead to all sorts of issues throughout the body, triggering constipation, insomnia, anxiety, exhaustion, seizures, and more. This also means this, moms and dads out there who are listening, when we actually address this root cause of dysautonomia head on, we can expect all sorts of incredible healing and transformation for your teen and young adult. The positive side effects of this specific kind of chiropractic care include better sleep, improved digestion, a stronger immune system, and most importantly, a balanced, calm, relaxed, regulated nervous system. So, what is the autonomic nervous system? The autonomic nervous system controls all your body's automatic functions like heart rate, blood pressure, digestion, and temperature regulation. It's made up of 2 branches: the sympathetic nervous system, or our fight or flight response, and the parasympathetic nervous system, or rest and digest mode. In a healthy individual, these 2 systems work together seamlessly to maintain balance. So let me explain dysautonomia in detail now. In dysautonomia, this delicate balance is disrupted, leading to a wide range of symptoms that can affect nearly every body system. Dysautonomia has 2 main problems associated with it. 1, the sympathetic overdrive, which is the fight or flight system gets just stuck on. And 2, the parasympathetic suppression or shutdown, the rest, relax, regulation side of the nervous system gets suppressed and shut down. And because the autonomic nervous system controls so many major physiological systems and functions in the body, problems start to show up all over and often in a specific order or sequence, such as the following: sleep, typically falling asleep; staying asleep, leading to fatigue, exhaustion, brain fog, etc. Digestion. The gut and digestive system takes a lot of energy and focus from the nervous system. So when it's sympathetic dominant, stuck in fight or flight, first place it takes energy and focus from is the digestive system. Immune function and inflammation. When stuck in a chronic state of stress, the body is left in a chronic state of inflammation and suppressed immune function. And brain health. When dysautonomia is fully kicked in, our mental, emotional, behavioral, and cognitive capacities are very much affected. So how do we find out dysautonomia? First, it's important to know that just like the supposed chemical imbalance theory for conditions like ADHD, anxiety, and depression, there is no valid medical testing for dysautonomia, which is why they completely miss it 99% of the time. The number one way to test for dysautonomia is through what are called neurological insight scans, specifically HRV or heart rate variability testing, that we run for every single patient right here at Vanella Chiropractic. In addition to HRV, we also run neurothermal and EMG testing, which further helps find patterns and evidence of dysautonomia and nervous system dysregulation and imbalances. When we look at scans of teens who started with dysautonomia and a completely out of balance nervous system, along with a myriad of chronic health problems, and then just a few months later, they have perfect scans and a vast improvement in every single area of their health and quality of life, parents, don't let dysautonomia and chronic health challenges hold your child and family back any longer. Thousands of parents and patients every single day are finding the hope, answers, and drug-free action steps they've been searching for with neurologically focused chiropractic care and Vanilla Chiropractic. Our incredible care program starts with a deep dive consultation, case history, where we'll ask questions and dive deeper than any doctor ever has to find the real root cause of your teen's chronic health challenges. Then from there, we'll run the insight scans, test for dysautonomia, nervous system dysregulation, and more, which takes about 15-20 minutes and will absolutely transform your understanding of what's really going on with your kiddos' health struggles. And finally, after we have this vital information from the consultation and insight scans, we'll sit down knee to knee at our reported finding visits, show you the scan findings, explain everything, and go over your child's customized care plan. Dysautonomia is a condition that can absolutely wreak havoc on your teen's health and really the whole family. But it doesn't have to be that way, since neurologically focused chiropractic care is a powerful care option to address it head on and see some amazing results. Simply click the link below, learn more about dysautonomia, chiropractic care, and how we can help.